She ate grilled turkey in Puerto Rico. Her husband sat across from her and ordered something else. One of them came home with photos. The other came home with something alive beneath her skin. 6 months after that dinner, Sarah Moreno was standing in front of her bathroom mirror when she noticed a thin line on her left thigh. At first, she thought it was a vein. Then she watched it move. Not twitch, not pulse, move slowly, deliberately, like something was crawling underneath her skin. She pressed her finger against it. The movement stopped. A few seconds later, it started again, traveling in a different direction. Sarah grabbed her phone and recorded it. The video lasted 23 seconds. It would eventually be viewed by infectious disease specialists across 3 hospitals. Because what was moving beneath her skin was not a vein, it was not a muscle, and it was not her imagination. Doctors would eventually discover a living parasite migrating through her body. But here is the part that terrified them. They still did not know where it was going.
This is Hidden Pathogens!
The trip had been Robert's idea. A week in Puerto Rico. No work emails, no deadlines, no notifications. Just beaches, sunshine, and 7 days away from the lives they had spent the last 3 years building together in Dallas. Sarah Moreno was 32 years old, a high school English teacher, the kind of person who never met a local dish she wouldn't try. If a menu had a section called House Specialty, Sarah ordered from it. If a waiter recommended something unusual, Sarah wanted it. Her philosophy was simple. The best part of traveling was eating something you could not get at home. Robert was different. Not fearful, just careful. He checked reviews before booking restaurants, read food safety ratings, asked questions most people never thought to ask. Was the meat fully cooked? How long had it been sitting out? Where did the ingredients come from? Sarah teased him constantly. One day you're going to research yourself out of having fun. Robert always laughed. And one day you're going to eat something that's going to make you regret it. For 7 years, neither of them had been right. Until Puerto Rico. They stayed at the same hotel, slept in the same room, drank from the same bottles of water, swam at the same beaches, shared the same rental car, walked the same streets. And for 6 days they ate almost every meal together. Remember that. Remember how similar everything was. Because by the end of this story, one of them will be sitting in an infectious disease clinic, watching a parasite crawl beneath their skin, and the other won't. The difference comes down to a single meal, a single order, a decision that took less than 10 seconds. Remember who ordered the turkey. Remember who didn't. Because only one of them is going to walk away from Puerto Rico, carrying something alive inside their body. It happened on their 6th night in Puerto Rico. The kind of night people remember for all the right reasons. The sky was turning orange over the water. A warm breeze rolled in from the ocean. Live music drifted across the beach from somewhere down the shoreline. The restaurant sat directly on the sand. No walls, no windows, just a wooden deck overlooking the Caribbean. The smell hit them before they even sat down. Charcoal, smoke, garlic, roasting meat. A massive grill stood near the entrance, flames licking through blackened metal grates. Tourists stopped to take pictures. Locals nodded as they walked past. Whatever was cooking smelled incredible. Their waiter handed them menus. Robert ordered first, grilled snapper, fully cooked, fresh from that morning's catch. Simple, safe. Then the waiter looked at Sarah. "If it's your first time here," he said, "you should try the turkey." Sarah smiled. "What makes it special?" The waiter pointed toward the grill. "Family recipe, marinated overnight, cooked over charcoal for 6 hours. People come from all over the island for it." That was all Sarah needed to hear. She closed the menu. "I'll take the turkey." Robert laughed. "Of course you will." An hour later, the plate arrived. The skin was dark and crisp. The meat practically fell apart under her fork. Smoke and spices soaked through every bite. Sarah took one mouthful and immediately pointed her fork at Robert. "You have to try this!" Robert shook his head. "You said that about octopus in Greece. You loved the octopus. I was lucky." Sarah laughed and took another bite. Then another. Then another. When the waiter came back, she told him it was the best thing she had eaten on the entire trip. The waiter grinned. He had heard that before. Dinner ended. The check arrived. They paid. They walked back along the beach. The waves rolled onto the sand. The music faded behind them. Neither of them gave the turkey another thought. Why would they? Sarah felt completely fine. No stomach pain, no nausea, no fever. Nothing that would make her remember that meal 6 months later. But while she slept that night, something was already inside her body. Something she could not see. Something she could not feel. Something that had arrived with the dinner she would spend the next year wishing she had never ordered. It would become the most expensive meal of her life. Here is what happened inside Sarah's body that night while she slept. The restaurant closed. The charcoal cooled. The beach emptied. Sarah and Robert returned to their hotel room. By midnight, both of them were asleep. Only one of them had a passenger. Somewhere inside the turkey Sarah had eaten was a parasite too small to see, too small to taste, too small to notice. The human eye never had a chance. Her stomach acid dissolved the food around it. The parasite survived. Then came the part that makes infectious disease specialists lose sleep. The larval form activated, microscopic, alive, programmed by millions of years of evolution to do exactly one thing: find a human body and use it. The larva emerged inside Sarah's digestive tract. It did not stay there. It burrowed through the intestinal wall and entered her bloodstream. Now it had access to the most efficient transportation network on Earth, the human circulatory system. Every heartbeat pushed it farther, through arteries, through veins, through capillaries thinner than a strand of hair, looking for a place to settle, looking for tissue, looking for somewhere to grow. Over the next several days, the parasite traveled through her body, past her liver, past her lungs, past her muscles, past organs that never knew it was there. The immune system should have stopped it. That is what the immune system is designed to do. But parasites like this have spent thousands of years learning how to hide. Some release chemicals that suppress local immune responses. Others surround themselves with protective layers that make them difficult to detect. Either way, the result is the same. The invader stays hidden, and the host never knows. Sarah spent the rest of the vacation feeling perfectly healthy. She swam, she shopped, she took photos. She laughed at Robert for checking restaurant reviews. She boarded the flight home convinced Puerto Rico had been one of the best trips of her life, because at that moment she had no reason to think otherwise. The parasite was already inside her, already moving, already growing, and Sarah felt absolutely nothing. For the first 2 weeks after Puerto Rico, nothing happened. At least, nothing Sarah noticed. She went back to teaching, back to grading papers, back to waking up before sunrise and fighting traffic to get to school on time. The vacation became what vacations always become. Photos on a phone, stories told to friends, a memory. If someone had asked Sarah whether she felt sick, she would have said no, and she would have believed it. Then came the small things, the kinds of symptoms nobody remembers, the kinds doctors hear 100 times a day. Week 3, Sarah started feeling tired, not exhausted, just slightly off, a little more drained than usual. She blamed work. It was the beginning of a new semester. Everyone was tired. Week 4, an itch appeared on her left thigh, a small patch of skin, nothing dramatic. No rash, no swelling, no pain, just an itch. She scratched it absent-mindedly while watching television and forgot about it 10 minutes later. A few days later, it came back. Same area, same strange irritation. Robert noticed her scratching. "Bug bite?" he asked. Probably. That was the end of the conversation. Because what else would it be? The itch disappeared again, then returned, then disappeared. Never severe enough to schedule an appointment. Never painful enough to cause concern. Just present enough to be annoying. There were other clues too. Tiny clues. The kind that only become important in hindsight. A brief tingling sensation in her leg. A moment of unexplained redness. A strange feeling beneath the skin that lasted seconds before vanishing. Each symptom appeared alone. Each symptom disappeared alone. None of them looked connected. None of them looked dangerous. And none of them gave Sarah any reason to think back to a restaurant in Puerto Rico. Meanwhile, something inside her body was continuing its journey. Growing, migrating, moving a little farther every day. The parasite did not need Sarah to notice it. In fact, it preferred that she didn't. By the end of the first month, Sarah felt healthy enough to go to work, healthy enough to exercise, healthy enough to live her life normally, which was exactly what made the infection so dangerous. Because the most frightening diseases are not always the ones that make you sick immediately. Sometimes they spend months convincing you that nothing is wrong. By the third month, the itching had become impossible to ignore. Not constant, not severe, just persistent, like a notification that refused to go away. Every few days, the same spot on Sarah's left thigh would flare up. The itching would start, then stop, then return somewhere nearby, always close, never exactly the same place. One morning, while getting dressed for work, she noticed a faint red line beneath her skin. It was only a few centimeters long, thin, slightly raised, gone by the next day. She took a photo anyway, just in case. A week later, a second line appeared. A little farther down her leg, Robert finally convinced her to make an appointment. The family physician examined the area for less than 5 minutes. No fever, no swelling, no signs of infection. The photos looked strange, but not alarming. The diagnosis came quickly, probably an allergic reaction. Maybe a detergent, maybe a soap, maybe a skin product. The doctor prescribed an antihistamine and recommended changing laundry detergent. Sarah followed the instructions. Nothing changed. The itching continued. The lines continued appearing and disappearing. A month later, she visited a dermatologist. This time the explanation was different. Skin irritation, possibly eczema, possibly contact dermatitis. The specialist prescribed a steroid cream. Again, Sarah followed every instruction. Again, nothing changed. For a few days, the symptoms seemed better. Then they came back. Same area, same strange pattern. The red lines would appear, remain for a day or two, then vanish, as though whatever was causing them had moved somewhere else. By month 4, Sarah had become obsessed with searching symptoms online. Every night she scrolled through medical websites. Rashes, autoimmune diseases, nerve disorders, allergies, nothing fit. The uncertainty started affecting her sleep. That led to another appointment. Another explanation. Stress, anxiety. The doctor wasn't being dismissive. Anxiety really can cause itching. Stress really can worsen skin conditions. And Sarah admitted she had been worrying about it constantly. The diagnosis made sense, at least on paper. So she tried meditation, better sleep, less screen time, more exercise. The symptoms ignored all of it. Because anxiety wasn't causing the problem. The problem was causing the anxiety. And somewhere beneath her skin, hidden from every doctor she had seen so far, the parasite continued moving. Month after month, appointment after appointment, diagnosis after diagnosis. Nobody suspected a parasite. Why would they? 32-year-old teachers from Dallas do not normally show up with tropical infections acquired on vacation. So the doctors kept looking for common explanations, and the real answer kept slipping past them. One wrong diagnosis at a time. 6 months after Puerto Rico, Sarah finally saw it. Not a symptom, not a rash, not a photograph she showed a doctor. The thing itself, it happened on Tuesday morning. Robert had already left for work. Sarah was getting dressed in front of the bathroom mirror when she noticed a raised line on the outside of her left thigh. She froze. The line was longer than before, almost 4 inches, thin, pale, slightly elevated above the surrounding skin. At first, she assumed it was another irritation, another one of the strange marks that had been appearing and disappearing for months. Then she looked closer. Something about it felt wrong. The shape, the position, the way it curved beneath the skin. Sarah touched it with her fingertip. The area felt firm, almost like a cord running through the tissue underneath. She pulled out her phone and took a picture. Then another, then another. Something made her stay. Something made her keep looking. And that decision changed everything. Because a few minutes later, the line wasn't in the same place. At first she thought she was imagining it. The human brain is excellent at finding patterns that do not exist. Maybe she had remembered it incorrectly. Maybe the angle was different. Maybe the lighting had changed. Then she opened the photo, and her stomach dropped. The line had moved. Not much, just enough. A few millimeters, but enough. Enough that the curve no longer matched the picture. Enough that she could not explain it away. Sarah stared at her thigh. Her heart began to race. The rational part of her mind searched desperately for alternatives. Muscle spasm, blood vessel, nerve, anything. Anything except what she was starting to suspect. She opened the camera again and started recording. 10 seconds passed, nothing. 20 seconds, nothing. 30 seconds. Then she saw it, a subtle shift beneath the skin, a slow ripple. The raised track advanced forward, not quickly, not dramatically, just enough to prove it was real. Sarah stopped breathing. The movement continued. A tiny migration, a living thing changing position inside her leg. She nearly dropped the phone. The video lasted less than a minute. It would later be reviewed by dermatologists, infectious disease specialists, parasitologists, and every one of them would reach the same conclusion. Sarah had not imagined it. The thing beneath her skin was alive. She called Robert immediately. At first, he thought she was joking. Then she sent the video. 3 minutes later, he called back. Neither of them said much. There wasn't much to say. For 6 months, doctors had called it an allergy, a skin condition, stress, anxiety. Now they were staring at footage that seemed to show something crawling beneath her skin. The itch suddenly made sense. The disappearing lines made sense. The strange symptoms made sense. What didn't make sense was what could possibly be living there. And more importantly, how far had it already traveled? Before we continue, if you're fascinated by real medical mysteries like this, share this video and subscribe to this channel. And if you value these videos, there's a free link in the description and pinned comment that helps support the channel. Every bit of click helps us continue researching and telling these stories, and it's completely free. And wait till you hear this. Might be even more scary. The emergency room at Parkland Memorial Hospital was bright in a way that felt unnatural at 2 a.m. Too white, too clean, too awake. Sarah sat on the examination bed with her phone still in her hand. The video was replaying on loop. The doctors had already seen it twice, then a third time. No one spoke for a moment after that. The ER physician tried to keep his expression neutral, the way doctors are trained to do when something does not fit into a known category. He had seen rashes, he had seen infections, he had seen rare skin conditions that made medical textbooks feel incomplete. But he had not seen that. Not movement, not migration, not something that appeared to travel beneath intact skin in real time. He ordered imaging immediately. Ultrasound first, then a high-resolution skin scan. The technician moved the probe slowly across Sarah's thigh. Everyone in the room watched the screen. At first, it looked like normal tissue, layers of fat, skin, muscle, nothing unusual. Then the technician paused, leaning closer, zooming in. There was something there, a faint structure, thread-like, curved. But when they tried to center it, it was gone, moved. The room went quiet again. A second scan was ordered, then a third. Each time, the result was the same. Something appeared, then shifted, then disappeared from view. The ER physician called dermatology, then infectious disease, then radiology. Within an hour, 3 specialists were standing in the room. Each one reviewed the video. Each one reviewed the scans. Each one asked the same questions. When did it start? Has she traveled recently? Any insect bites? Any freshwater exposure? Any undercooked food? Sarah answered everything honestly. Robert stood beside her, repeating what he could remember from Puerto Rico. The grilled turkey, the beach restaurant. The rest of the trip had been normal. That detail changed the tone in the room. Not dramatically, but noticeably, because now there was no obvious exposure route, no clear explanation. The infectious disease specialist finally spoke, carefully. We've seen migrating skin infections before. A pause, but not like this. Another pause. We've never seen something move this clearly beneath intact skin without a visible entry point. The words hung in the air. No one corrected him. No one offered a better answer. Because there wasn't one yet. By sunrise, Sarah had been admitted for observation. Blood samples were taken. Skin biopsies were scheduled. And consults were requested from parasitology departments at 2 separate universities. Robert stayed in the chair beside her bed. Neither of them slept, because every few hours, Sarah would look down at her leg again, half expecting it to stop, half expecting it to disappear. But it didn't. Whatever was inside her was still there, still moving. And now, so were the doctors. By the second day in the hospital, the case had already changed shape. Not medically, Not yet, but professionally. Sarah was no longer a skin condition. She was now a multidisciplinary consult. Dermatology, infectious disease, radiology, even neurology, just in case the sensation she described had a neurological component. Every specialist brought a different possibility. Every possibility led nowhere. The scans still showed something inconsistent. The videos still showed movement that didn't match any known pattern of human skin infection. And the biopsies, when they came back, showed inflammation. But no clear organism, no bacteria, no fungus, no parasite visible in the sample. Just tissue reacting to something the lab could not identify. By the afternoon of the second day, frustration had started to creep into the room. Not from Sarah, from the doctors, because medicine is built on patterns. And this case had none. That was when the third infectious disease consultant arrived, Dr. Patel. He didn't introduce himself with confidence. He introduced himself with silence. He reviewed everything slowly. The video, the scan reports, the biopsy notes, the timeline. 6 months, that detail made him pause. 6 months of intermittent symptoms before visible movement. That was not typical for bacterial infection. Not typical for dermatologic conditions either. He leaned back slightly, then asked the question no one else had asked properly. Has she traveled internationally in the last year? The room shifted. Subtle, but immediate. Robert answered before Sarah could speak. Yes, a pause. Puerto Rico. Dr. Patel didn't react outwardly, but something in his posture changed. Not certainty, not diagnosis, something closer to direction.
Just Puerto Rico?
He asked. Robert nodded. 1 week, 6 months ago, Doctor. Patel turned back to the chart, then to Sarah. Did you eat anything unusual during your stay? Sarah hesitated, then shook her head. Just local food, Robert interjected quietly. There was one restaurant, beachside place. She had grilled turkey, I had fish. That was the moment the room changed. Not because turkey was the answer, but because now there was a timeline. Exposure, incubation, delayed symptoms. Dr. Patel asked one more question. Before that trip, had she ever had anything like this? Sarah shook her head again. No. He nodded slowly, then said something that made the entire room go quiet. This is no longer a dermatology case. He closed the chart and looked at the others. We need to think beyond common skin conditions. Then the line that shifted everything. We may be dealing with a parasitic migration. No one disagreed immediately, because no one could yet prove he was wrong. And for the first time since Sarah had arrived at the hospital, someone had finally connected time, travel, and symptoms into a single possibility. Not a certainty, not yet, but a direction. And in cases like this, direction was everything. The next morning, Sarah was moved to a different wing of the hospital. Not because she was getting worse, but because the case had become something else entirely. A teaching case, a consultation case, a we need more eyes on this case. Samples were sent overnight to a reference laboratory specializing in tropical and parasitic diseases. By noon, the results came back, and the room finally had a name for what they were dealing with. A parasitic larval migration consistent with cutaneous larva migrants-like infection with atypical deep tissue involvement. It was not common in travelers from Puerto Rico. It was not common in adults presenting this late, and it was certainly not common to be visible moving beneath intact skin months after exposure. But the lab was careful with language, consistent with, not definitive, because parasites like this rarely behave exactly as expected. The infectious disease team gathered again, this time with printouts, diagrams, life cycle charts. Dr. Patel pointed to the first image. This is what we believe entered her system. A larval parasite, microscopic at ingestion, capable of surviving passage through the stomach, capable of penetrating intestinal barriers under rare conditions of contamination. Once inside the bloodstream, it followed a predictable pattern: travel, migration, homing. But where it ended up was not always predictable. That was the danger. The parasite did not stay in one place. It moved, slowly, strategically, through tissue planes, between muscle layers, just beneath the skin in Sarah's case. Dr. Patel continued. The reason it stayed hidden for months is simple. He tapped the chart. At first, the body doesn't recognize it as a threat. The immune system is designed to respond to speed, infection, inflammation, sudden changes. But this organism did not act suddenly. It moved slowly enough to avoid triggering a full immune alarm. Instead, it produced localized irritation, small inflammatory reactions, fleeting rashes, temporary itching, symptoms that appeared and disappeared before the body could fully commit to responding. That was why the earlier diagnoses had failed. Allergy, dermatitis, stress response. Each one explained a fragment of the pattern. None explained the whole. Then came the second part of the explanation. The movement. Dr. Patel turned the screen toward Sarah's scan. There are organisms that don't stay static. He paused. This one appears to be actively migrating through subcutaneous tissue. The room went quiet again, because that explained the video, the shifting line. The movement Sarah had captured. It wasn't random. It was navigation. The parasite was not stationary. It was traveling, and the most important question was no longer how it got there. It was where it was going. A surgical specialist finally spoke. "So what is the goal here?" Dr. Patel didn't answer immediately, because the honest's answer was unsettling. "Survival," he said. "That's all it is doing." Then he added something quieter. "And in some cases, continued migration means it has not found a place it considers stable yet." Sarah looked down at her arm instinctively. For the first time, she wasn't just thinking about what was beneath her skin. She was thinking about where it might go next, because now everyone in the room understood the same thing. This was not a rash. This was not irritation. This was a living organism inside her body, and it was still moving. By the third day, the diagnosis was no longer uncertain. It was confirmed. A living parasite migrating through subcutaneous tissue, visible, active, moving. But confirmation did not bring relief. It brought a new problem, because now the question was no longer what is it. The question was, how do you remove it without making things worse? The treatment team met in the early morning. Dermatology, infectious disease, general surgery, and one neurosurgical consultant brought in, not because the parasite had reached the brain, but because of what it represented. Uncontrolled migration inside living tissue. Patel stood at the center again. He laid out the options carefully. First option, antiparasitic medication. Drugs designed to kill the organism internally. Theoretically effective, but not without consequence. Because killing a migrating parasite inside tissue does not make it disappear quietly. It triggers inflammation. The immune system reacts violently to the dying organism. Swelling, pain, secondary tissue damage. In some cases, severe systemic inflammatory response. Second option, surgical removal. Locate the parasite. Track its position in real time. Attempt extraction through a small incision. In theory, more controlled. In practice, extremely difficult, because they had one major problem. The parasite did not stay still. A surgeon reviewed the imaging again. "It's moved twice since yesterday," he said. That sentence changed the room again. Not dramatically, quietly, because surgery requires certainty, a fixed location, a target. And this was not fixed, this was mobile. Sarah sat on the hospital bed listening to all of it. She had stopped crying the day before. Now she was just listening. Robert sat beside her, not speaking, waiting for a solution that sounded like something from medicine, not something from war. Dr. Patel continued. "There is also a third risk." Everyone looked at him. He didn't rush the words. "If we begin treatment while it is still actively migrating, we may force it deeper. And deeper tissue involvement increases the risk of nerve damage, vascular injury, or permanent scarring." The word nerve landed heavily, because Sarah was not just dealing with discomfort anymore. She was dealing with cation. If it crossed a nerve pathway, it could cause chronic pain. If it reached a blood vessel, it could trigger bleeding or embolic complications. If it moved unpredictably during intervention, the sentence didn't need finishing. The implication was enough. The surgeon finally spoke again. "So we either kill it and risk a violent immune response." He looked down at the imaging. "Or we try to extract it and risk losing its location entirely." That was the paradox. The cure itself could become the danger. Sarah looked at Dr. Patel. "So what do I do?" It was the first time she had spoken in nearly an hour. Dr. Patel didn't answer immediately, because this was the part medicine never made simple. "We stabilize first," he said. "Monitor its movement, map it as accurately as possible. and only then, choose intervention. Robert exhaled slowly. So we wait. Dr. Patel nodded once. Yes, a pause, but we don't wait passively. He looked at Sarah again. We track it every day. Sarah glanced down at her skin. Somewhere beneath it, something was still alive, still moving, still making decisions she could not feel. And now she understood the final truth of her situation. The most dangerous part of this illness was no longer the parasite itself. It was the fact that removing it might be worse than living with it. It took 6 weeks before the medical team agreed on a plan, not because the parasite changed, but because its movement finally slowed enough to predict. A small cluster of specialists worked together like a surveillance unit. Daily imaging, mapped progression, careful timing. Then, one morning, it stopped moving for longer than usual. That was the window. Sarah underwent a combined treatment approach, a low-dose anti-parasitic regimen to avoid a violent inflammatory surge, followed by a targeted surgical extraction guided by ultrasound imaging. It was precise, slow, controlled. The kind of procedure that only works when everything goes right. And for Sarah, it did. The parasite was removed intact, small, thread-like, alive at the moment of extraction, and then no longer alive. But the relief did not arrive immediately, because the damage was already done. Inflammation in surrounding tissue lingered. Nerve sensitivity remained elevated for weeks, and the psychological weight of what had been inside her body did not disappear just because it had been removed. Robert was with her when she was discharged. Neither of them spoke much in the car ride home, because both of them were thinking about the same thing: how close they had come to never knowing what it was. How easily it could have been ignored. How many times it had been dismissed as something harmless. Weeks later, Sarah returned for follow-up imaging. The doctors showed her the scans. Clean, no remaining migration, no active infection. Only residual tissue changes where the parasite had once traveled, scars in their own way, permanent reminders of movement beneath the skin. By month 3, Sarah was back at work, not fully the same, but functioning, sleeping normally again, eating normally again, living without constant monitoring of her own body. But she still checked her skin sometimes, out of habit. Not fear, just memory. Robert still remembered everything too, especially the dinner. The beachside restaurant, the charcoal grill, the moment she ordered the turkey, and how ordinary that moment had seemed. Now, when they thought about Puerto Rico, they didn't think of the ocean, or the sunsets, or the hotel. They thought of divergence, because the truth was simple. They had shared the same island, the same hotel, the same vacation. They had walked the same streets, sat in the same restaurant, drank from the same bottled water, laughed at the same sunsets. But they did not share the same outcome. One decision had separated everything that came after. One plate of food, one order placed without hesitation, and one refusal that changed nothing in Robert's life, but changed everything in Sarah's. Same island, same restaurant, same vacation. One ordered the turkey, one didn't. One went home and forgot about it. The other went home and discovered something alive beneath her skin. She ate grilled turkey in Puerto Rico. Her husband sat across from her and ordered something else. Same restaurant, same island, same vacation. One came home with memories. The other came home with a parasite living beneath her skin. 6 months later, Sarah Moreno stood in front of her bathroom mirror again. The same mirror, the same bathroom, the same quiet morning light coming through the window. But she was not the same person who had stood there before. She lifted her shirt slightly, waited. At first, there was nothing, no movement, no line, no sign of anything beneath the skin. For a moment, she thought about everything that had happened. The itching, the misdiagnosis, the hospital room, the video, the scans, the decision to treat, the long weeks of waiting while doctors tracked something she could not feel but had once watched move beneath her own skin. Then she saw it, a faint ripple, barely visible, a memory more than emotion. Not the parasite itself anymore, just the aftermath it left behind in tissue that would never be exactly the same again. She exhaled slowly, not fear, not panic, just awareness, because she knew what it meant to have something alive beneath your skin, even if it was gone. Robert called from the other room. "Everything okay?" Sarah looked at the mirror one more time, then turned away. "Yes," she said. And for the first time in months, it was true. But the truth had changed shape, because now she understood something she would never fully unlearn. How fragile the line was between normal and irreversible, between memory and infection, between a meal and a medical case study. She thought about Puerto Rico again, the beach, the restaurant, the grilled turkey, and how ordinary it had all seemed. That was the part that stayed with her. Not the parasite, not the hospital, not even the treatment, but the simplicity of the moment before everything changed. If you made it all the way to the end, thank you. These stories take a lot of research to put together. If you'd like to support the channel, you'll find a free link in the description and pinned comment. Checking it out helps support future videos, and every click allows us to keep bringing these cases to the channel. Also, it's completely free. And if you learned something from this case, share and subscribe for more real medical stories. And if you chose not to subscribe, leave a comment and tell me what would make these videos better. I read far more comments than you might think. This is Hidden Pathogens. I'll see you in the next video. Good night.
This is Hidden